Ovarian cancer is often called the silent killer for a reason. Its symptoms are subtle, easily mistaken for other benign conditions, and often go unnoticed until the cancer has reached an advanced stage. Yet, early detection can make a significant difference in treatment outcomes. Understanding the signs of ovarian cancer, especially the ones you may be ignoring, is crucial for your health and peace of mind. Let's begin by addressing the nature of ovarian cancer. The ovaries are small organs located on each side of the uterus in the female reproductive system. They produce eggs and hormones such as estrogen and progesterone. Ovarian cancer occurs when abnormal cells in the ovaries begin to grow and multiply uncontrollably, forming a tumor. If left undetected, the cancer can spread to other areas of the abdomen and body. Now, why is ovarian cancer so difficult to catch early? Unlike other cancers, there is no reliable screening test for ovarian cancer in women who are not at high risk. Pap smears, for instance, are designed to detect cervical cancer, not ovarian. This means that women must rely on recognizing the symptoms and acting quickly if they appear. So, what are the warning signs of ovarian cancer that you might be ignoring? Let's explore them in detail. One of the most common early symptoms is high abdominal bloating or swelling. While it's normal to feel bloated after eating a large meal or before your period, persistent bloating that doesn't go away or seems unrelated to your dietary habits may be cause for concern. Many women attribute this sensation to digestive issues or stress, but if you find that your abdomen feels consistently distended, it's important not to dismiss it. Next, pay attention to pelvic or abdominal pain. Occasional cramps are common, particularly around menstruation. However, ongoing or frequent pain in your lower abdomen or pelvis, especially when it's new or different from your usual menstrual discomfort, could be a red flag. This pain might feel dull, aching, or sharp, and it may come and go or be constant. Another sign that's easy to overlook is a feeling of fullness quickly while eating. If you notice that you become satiated after eating only a small amount of food, or you lose your appetite without a clear reason, it could be a symptom of ovarian cancer. This change is sometimes attributed to stress, dietary changes, or other benign conditions, but if it persists, it's worth investigating. Frequent or urgent urination is another sign to watch for. The ovaries are located near the bladder, so a tumor can put pressure on your bladder, causing you to feel the need to urinate more often or suddenly and urgently. If this is a new symptom for you and you don't have a urinary tract infection or other known cause, it's important to mention it to your doctor. Some women experience unexplained changes in bowel habits, such as constipation or diarrhea. These symptoms are common and often related to diet or stress, but persistent changes in how often you have bowel movements or the consistency of your stools can sometimes be linked to ovarian cancer. For instance, if you notice chronic constipation that doesn't respond to over-the-counter remedies, it's worth discussing with a healthcare provider. Unexplained weight loss can also be a sign. While many people are happy to see the numbers drop on the scale, losing weight without trying, particularly if it's rapid or significant, could indicate an underlying health issue, including ovarian cancer. The weight loss may be accompanied by fatigue or weakness. Now, back pain is another symptom that's frequently overlooked. While back pain is a common complaint for many reasons, persistent, unexplained pain in the lower back, especially if it's new or doesn't improve with rest, could be a signal that something is wrong. Ovarian cancer can cause back pain due to pressure in the abdomen or the spread of cancerous cells. Another possible sign is menstrual irregularities or abnormal vaginal bleeding. While many women experience changes in their menstrual cycle from time to time, irregular periods, especially after menopause, should always be evaluated. Ovarian cancer can sometimes cause bleeding between periods, heavier periods, or postmenopausal bleeding. Fatigue is a common symptom of many illnesses, but unexplained persistent fatigue that doesn't improve with rest can be a sign of ovarian cancer. If you find yourself feeling constantly tired, weak, or lacking in energy, even after a good night's sleep, it's worth paying attention. Some women may notice pain during intercourse. If sex becomes uncomfortable or painful, and this is a new development, it may be related to ovarian cancer or other gynecological conditions. This symptom should not be ignored, especially if accompanied by other signs. Indigestion, heartburn, or nausea can occur as well. Many people experience indigestion now and then, but persistent digestive problems that don't have a clear cause should be evaluated. Sometimes ovarian cancer can press on the stomach or intestines, leading to these unpleasant symptoms. You may also notice swelling in your legs. This can happen if a tumor presses on veins or lymphatic vessels, causing fluid to build up in the lower extremities. Swelling that is persistent, particularly if accompanied by pain, redness, or warmth, should be checked by a healthcare provider. It's important to remember that many of these symptoms are nonspecific and can be caused by conditions other than ovarian cancer. However, the key is persistence and change. If you experience one or more of these symptoms nearly every day for more than a few weeks, or if they are new and different from your normal state of health, you should seek medical advice. There are also certain factors that can increase your risk of developing ovarian cancer. These include a family history of ovarian, breast, or colorectal cancer, genetic mutations such as BRCA1 or BRCA2, age, most cases occur in women over 50, never having been pregnant, hormone replacement therapy, and certain fertility treatments. If you have any of these risk factors, it's especially important to stay vigilant and communicate any new symptoms to your doctor. So, what should you do if you notice these symptoms? Don't panic, but don't ignore them either. Keep a symptom diary, noting how often the symptoms occur, how severe they are, and any other changes you observe. This information can be very helpful for your healthcare provider in determining the next steps. Your doctor may perform a pelvic examination, imaging tests such as ultrasound or CT scan, and blood tests, including one for a tumor marker called CA125. While these tests are not definitive for all cases, they can help guide further investigation. Early detection is key. When ovarian cancer is found and treated at an early stage, the chance of survival is much higher. Unfortunately, because the symptoms are often vague and easily overlooked, most cases are diagnosed at a later stage when the cancer has already spread. That's why awareness is so crucial. Listen to your body and trust your instincts. If something feels wrong or different, even if it seems minor, don't hesitate to reach out to your healthcare provider. Advocate for yourself, and don't be afraid to ask questions or seek a second opinion if you feel your concerns are not being addressed. Remember, your health is your most valuable asset. Taking the time to pay attention to subtle changes and acting on them could make all the difference. Don't ignore the signs. Your vigilance can save your life. Stay informed, stay proactive, and encourage the women in your life to do the same. Ovarian cancer may be silent, but with knowledge and awareness, you can give yourself the best chance at early detection and effective treatment.